As the Michigan opioid epidemic grows, so does our responsibility.
To protect our patients.
To provide quality care.
To make informed decisions by checking before we prescribe.
The Michigan Automated Prescription System, also called MAPS, is a monitoring tool that helps healthcare professionals protect patients and prevent opioid misuse. It makes it easy for physicians, physician assistants, and nurse practitioners to collect and analyze data in real time. It's important to discuss this controlled substance data with patients to decrease opioid misuse, opioid-related deaths, and treat our patients with best evidence-based medicine for pain control. Let's all work together to protect our patients.
The opioid epidemic is a growing problem in Michigan. MAPS helps us to make informed decisions before we prescribe. By checking MAPS, physicians are working to help end the opioid epidemic. We are seeing too many people who are dying from opioid overdoses. We're also seeing too many children that are orphaned because they've lost their parents to this epidemic. MAPS is very easy to use. We actually can click on MAPS from within the patient's electronic medical record. It's simple and it's the right thing to do for our patients.
MAPS provides this ability for the providers to engage the patients better based on the results from the MAPS reports. So patients are able to ask specific questions about their drug dosages, and also allows the provider to sit down and discuss with the patient alternative treatment options for the patients.
For my patients that request opioids postoperatively for pain management, I'll query them in MAPS. It provides a lot of information on the number of prescribers prescribing for the patient, the types of prescriptions, the pharmacies that they're going to, the number of aliases the patient may have. And those are all red flags that they're possibly having an addiction problem. So if I do see red flags, it gives me the tools to find out who the prescriber is, and I can contact that prescriber, and then we can kind of tailor their treatment after that to deal with that possible issue. Younger patients that I see are usually opioid naive patients. In other words, they've never had a prescription for an opioid. So I'm usually the first person to give them a prescription.
I care, I check.
I care, I check.
I care, I check.
I care, I check.
He checks because he cares.
The MAPS system is a roadmap to better care. Learn more at Michigan.gov/MiMapsInfo. For more information, visit Michigan.gov/opioids.